Let's talk about the top 3 ways providers trick you into overpaying medical bills. Yeah, it's a thing. Medical bills are the number 1 cause of debt and bankruptcy in the United States, is because we get tricked into thinking we owe a crap ton of money that we really don't owe. So let's talk about it. Number 1, it's when you pay a summary bill. The number 1 way that we get tricked into paying a lot more than we owe is by thinking a summary bill is a real bill. And what's a summary bill? What does that mean? That's a bill that doesn't have CPT codes. CPT codes are to medical services what barcodes are to products in a store. How are you going to determine what you're paying for if you don't know what the code is, right? It may say something like pharmacy services or laboratory services or office visit. That's like going to a grocery store and you get a bill for something that says produce department. Well, yeah, but iceberg lettuce costs a lot less than organic spinach, right? In the same department. But how do you know what you're paying for? Great example. This happened a couple of years ago. Somebody posted their bill on TikTok of having a baby. And Bill said something like labor and delivery, skin to skin, total. So 3 lines. The line that said labor and delivery was something like $21,000 and some change. The second line that said skin to skin said $39.95, $39.95. And then the third line was the total. The thing is, of course, there were no CPT codes on this bill. It was a summary bill. And why I'm laughing about it is that skin to skin is what they were charging her for when the baby is delivered, putting the baby on the mom's chest. It's just insane. And why this is important when I talk about why you just never pay any medical bill that doesn't have CPT codes. Because just to cut to the chase, folks, there is no such thing as a CPT code for skin to skin. They made it up. And that's just a small example because a lot of these, what I call wishing numbers, made up numbers because they're wishing and hoping and praying they'll fall for it. These summary bills have just all kinds of stuff in there, or can have things in there that have nothing to do with reality. Just ask for a real bill, itemized bill with CPT codes, or a UB04 form. If it doesn't have a CPT code on it, you're not going to pay it. An insurance company will never pay for anything that doesn't have a CPT code. Why should you? Number 2, top ways that providers trick you into overpaying medical bills is that with that summary bill that you got, they'll be like, yeah, okay, if you pay now in full, we'll give you a 10% discount. Or let's say you were successful and you got an itemized bill with CPT codes, and they're like, okay, 10% discount if you pay it right away. The thing is that without doing a price check against what a fair prices or fair charges for the services you received, that 10% discount is nothing. You could actually get a higher discount if you know what a fair rate for the services you received are. So let's talk about what this means. Let's talk about how do you do a price check to make sure you're getting a fair rate. So that is to do an AI search or upload to medicalbillrelief.com. Up will pop the Medicare rate and the fair charge for the services you received. Medicare rates are the lowest rates that any provider in the United States will accept for medical services. And the difference is a lot more than 10%. And then once you get that number, the fair rate for the services you received, total up, and you're going to call back and say, hey, yeah, the services I received, I know I got a bill for this. This is what I'm willing and able to pay. Who can I speak with who can help me make a monthly payment plan? The third top way that providers trick you into overpaying medical bills is if you have insurance, the provider will make you believe that you owe a balance bill. A balance bill is when you have insurance and you go to a provider who is in network with your insurance company. In network means that they have agreed to pay or agreed to accept as payment in full any amount that the insurance company agrees to pay. So let's say that a provider charges $100 for a particular medical service. If they are in network with an insurance plan, in exchange for having access to sometimes millions of potential patients, they will say, okay, we'll give you a huge discount on our services in exchange for having access to all of your members, and we will accept $10. The insurance company will say, yeah, we pay $10 for this so you can have access to our members. And it sounds like a huge difference, $100 versus $10, right? But it's not unusual. Again, these numbers that providers, medical systems, hospitals create are fiction. They're totally made up, what I call MRSP, manufacturer retail sticker price, just so they can say to insurance companies who they want to be in network with, look at this huge discount we're giving you. So a balance bill is when an in-network provider says, hey, yeah, you know that service that we provided for you, that medical care you received from us, we charge $100 for that. But your insurance company only paid us $10. You owe us the balance, which is $90 in our hypothetical example. Now, there are many hospitals, medical systems, facilities that are much more scrupulous and don't do this, but there are too many that do this and have gotten in trouble with their state departments of insurance for this. Basically, when a provider balance bills a patient for whom they are in network with their insurance company, that's balance billing. That's a form of contract fraud. And the reason why it's something that we don't hear about, we don't talk about, there's no pushback, is because the patient is not part of that contract. The contract is between the insurance company and the provider. If you think about it, the insurance companies don't know when a provider is balance billing their members. How are they going to know? How are they going to find out? Unfortunately, there are too many medical centers, systems, hospitals that depend on this. You also want to make sure that it's a balance bill, meaning if you haven't met your deductible or you have co-insurance, meaning whatever the insurance company agrees to pay for services you received, you owe a portion. So a common ratio of co-insurance is 80-20. That means if the insurance company agrees to cover it, they'll pay 80%, but you're on the hook for the other 20%. So when you're checking to see if you've gotten balance billed, make sure you've met your deductible for the year. There's a lot of statistics that show 70% of us in this country with commercial health insurance don't meet our deductibles. And the insurance companies know this and they count on that. So if you haven't met your annual deductible for the year, New Year's Eve, when the ball drops and the clock strikes 12, basically we are uninsured. And that's because we haven't met our deductible. Number one, check to see if you've met your annual deductible. Two, if you met your annual deductible, make sure that you paid your copay, which is, usually less than $100, between $20 and $100 for whatever services you received. And then check to see if you have co-insurance as part of your plan. If you have co-insurance, that balance is what you owe. You may actually owe it depending on what your ratio is, your co-insurance rate is. 60-40, 80-20, 90-10. That bottom number is what you owe. Now, you've gone through your bill and you've met your deductible for the year. You've already paid what is your portion of the co-insurance and they're still sending you a balance. If you want to use your insurance to pay for those services, make sure that it says something about your insurance covering it. Adjustments, payments, discounts, or the terms that you're usually going to look for. If that's not there, you need to call the billing department and say, hey, you forgot to submit it to my insurance. I do not want to pay cash for this. I want my insurance to pay for this service. Please send it to my insurance company. So once you see whatever insurance paid for, whatever's left, make sure you've met your deductible, number one. Number two, to see if you have co-insurance. And number three, you made whatever copay for the services that's required. I had a client who got a huge bill, they said, from their physical therapy services. And they said, you know what, I think I'm being balance billed, Virgie. Can you look at this? And I looked at it. And it turns out that they never applied the copay for each visit. It was like a $20 copay. That adds up fast. Those co-pays, when you have physical therapy, that's like 3 visits a week. That adds up. In this case, it was like $600 that they did not apply to their bill. So it wasn't a balanced bill. It was you double check and make sure that they applied your copay to your bill. So I had the person call the physical therapy provider back and say, hey, yeah, what about the copays? I paid these copays. And they're like, oh, so sorry. Our mistake. Mistakes happen. Just make sure they don't cost you. So there you go. The top 3 ways providers trick you into overpaying medical bills. I believe these are the biggest reasons, the top 3 reasons why medical bills are the #1 cause of debt and bankruptcy in the United States. You're going to make sure it doesn't happen to you. Go to medicalbillrelief.com for more support.